Hello, I'm Dr. Igor Simonov, and today I'm going to talk about the difficulty 53 of NanJing and how we can apply it for treatment of diseases with not good prognosis. So, difficulty 53 of NanJing explains that when disease moves from mother to son, it makes 5 movement. These 5 movement produces 5 changes and it is live. But when disease goes through the dominating direction, dominating cycle, core cycle, it produces actually like that. It produces 5 movements and actually 7 changes happens, and after that death comes. So first of all, how with this 5 movement we can see actually 7 changes, because it's only just one. From the heart disease go to the lung, from the lung to the liver, from the liver to the spleen, from spleen to the kidney, and from kidney come back to the heart. So it's only 1, 2, 3, 4, 5 changes happens with these 5 movements. But if we will look actually to the old map, which was used for Wu Xin, so we can see actually a little bit different. So first disease come from the heart and it affect the lung. Is the first movement. From the lung it goes through the spleen to the liver. Is the second movement. From the liver it goes to the spleen, third movement. From the spleen, pancreas, it goes to the kidney. It's the fourth movement, and it returns back to the heart. During this movement, no one organ actually affect is hit twice, as it said that 53rd difficulty. But actually, here we can see that during 5 movement, 7 changes happen. So first it goes to the lung, is the 1. From lung it goes to the liver through the spleen, so it is 2, 3. From liver it goes to the pancreas, spleen, 4. From pancreas it goes to the kidney, 5. From kidney it goes affect the heart, but it goes again through the spleen. From kidney to the spleen it is 6, and from spleen to the heart it is 7. So actually 7 changes happens. So how it would be, for example, if it really we will take the same for the mother, son, and what will happen in this old Wu Xin map. So it will be 1, 2, 3, 4, 5. So actually in the old Wu Xin map also only when it goes from the mother to the son only 5 changes happens, and when it goes by the dominating cycle it is 7 changes happens. So after these 7 changes death occur. So but in reality we don't see often these cases when the patient are so bad so they die. So why does it happen? Because actually our body has also its compensation mechanism when actually from the heart disease go to the large intestine. It is filtered through the low to the lung. From the lung it goes to the gallbladder. It is filtered through the low to the liver. From the liver it goes to stomach. It filtered through the low to the pancreas. From pancreas it goes to the urinary bladder. It filtered through the low to the kidney. From kidney it goes back to small intestine, but it doesn't hit actually hard, and it filtered back. So organs are not affected twice. But in reality, sometimes when the pathology happens and the sum of these compensation mechanism is affected, the movement happen like following. From the heart it go to the large intestine and straight away affect the liver. So we can see a following picture. 1. From the large intestine it goes to the stomach. From the liver it goes to the stomach and go back to the kidney. 2. From kidney it go to the small intestine and return to the lung. 3. From the lung it goes to gallbladder and return to the pancreas. 4. And from pancreas it goes to the urinary bladder and return to the heart again, and it is the 5th movement. So knowing that, we can prevent diseases, and we can treat diseases with a not good prognosis. For example, here I have the map of the patient who came with the high blood pressure, hypertension. So his blood pressure was usually about over 200, more, 210, 220, over 100. So this patient didn't want to use any medicine, and he tried acupuncture for some time, which didn't bring him result, and finally he came to see me. So what we can see here, they actually NanJing organs, they are where they supposed to be: lung, heart, pancreas, liver, kidney, on the line where they supposed to be. But large intestine is little bit deficient, small intestine deficient, stomach in excess, sanjiao is in excess, and urinary bladder is in excess. According how we can actually find, how these affect different meridians, how the movement happens, we can see that, for example, all the meridians which are on the earth, they're communicating. The wood is communicating to the wood and to the fire, because the second deep with the second deep pulse. For example, most lung metal is communicated to the metal. First superficial with the most deep pulse. So deep pulses with the superficial pulses, second deep with the second superficial, and which are in the middle, they are only with that in the middle. So what we can see here, that actually patient movement of this patient happen in the following way. Receive from the heart, disease went to the large intestine, straight from the large intestine, because it failed the low, it return it to the liver, and from liver to the stomach. So actually 2 meridians, large intestine and the liver, which receive energy and send it backwards, they are affected. So in this case we had actually treat not only, as I was telling in the video 11, how we can use the prevention and using also points over the earth, here the earth points, and when we use the puncture to prevent this movement of this pathological energy from one to other one, moving disease from one meridian to another one, we need to use the earth point. In this case we had to use also low points over the lung and large intestine. These low meridians were affected, and the liver and gallbladder, because they low, also were affected. And after few treatments, with the first treatment the blood pressure started to normalize, but now patient actually, if we will look his map, there is not any of these, not one of these 7 movement which produce the death happen. Only one from the between the heart and Sanjiao. So what happens that now patients, after a few years he had 200 over 100, more than 200, and now he had the less than 130 over 80. So knowing this difficulty 53 and how we can apply it, this 7 movement, 7 mutations which happen, how we can prevent it and how we can treat it. Thank you.